Welcome, everyone. In this explainer, we are going to tackle one of the trickiest, most high-stress parts of our job, the endodontic emergency. Let's get right into it. We've all been there, right? You get that phone call, and it can just throw a huge wrench in your entire day. But look, if you have a system, you can handle this with total confidence. So we're going to break down the entire process, step by step, starting right from the moment that phone first rings. So the patient calls, they're in a panic. But before you start rearranging your whole schedule, your first mission is to play detective. Is this a genuine can't-wait emergency, or is it something that could hold off? A couple of smart questions over the phone will tell you everything you need to know. And what's great is how simple this filter is. A true emergency hits all three of these points. First, it's messing up their life. They can't work, they can't sleep. Second, it's acute. It just started in the last day or so. And third, this one's key, they've tried over-the-counter stuff, and it did absolutely nothing. If they tell you, well, I can't miss the big game tonight, yeah, probably not a true emergency. Okay, so the patient passed your phone test, and now they're sitting in your chair. Your next big job is to go from their story, it hurts here, sort of, to a rock-solid diagnosis. This is where we really earn our stripes. This chart right here, this is your cheat sheet. You're basically a detective matching their clues to one of these culprits. Is the pain vague, all over the place, and worse when they lie down? Boom, you're thinking irreversible pulpitis. Can they point to the one exact tooth that screams when you tap on it? You're probably looking at a necrotic tooth with apical periodontitis. Seriously, screenshot this. It's absolute gold for your exam prep. Okay, let's dive into scenario number 1, the inflamed vital pulp, the classic hot tooth. The nerve is alive, but it's screaming mad. Your only goal here is to get in there and remove the source of that fire. Now, this right here is absolutely crucial. This is about managing expectations. You know that severe inflammation changes the local pH, which makes anesthesia way less effective? You have to explain this to the patient before you even start. Frame it just like this. The inflammation you have is pretty intense, which can make the anesthetic a bit stubborn. But don't worry, we have ways to manage it. This builds massive trust and correctly explains what's happening. So when you're facing that hot tooth, what's the play? Should you do a partial treatment or go all the way? Well, the evidence is crystal clear. A pulpotomy, where you just remove some of the pulp, often leaves inflamed tissue behind, and that means more pain for the patient later. If you have the time, a full pulpectomy gives them the best shot at real, lasting relief. Okay, let's switch gears to our second scenario, the abscess. When you see swelling, I want you to think of one word: pressure. Think of it like a balloon that's about to pop. The whole game is about one thing. You have got to establish drainage. This slide lays out the game plan perfectly. You get access, and then you hit the key step, establishing apical patency. That just means you take a tiny file and gently push it just past the end of the root to create an escape route for all that pressure. And here's a huge clinical pearl. Think about using saline to irrigate first. Why? Because bleach can actually make the pus thicker, creating a clog and stopping it from draining. And please, do not forget this simple, ridiculously powerful step. Take the tooth out of the bite. By grinding it down just a little, you're giving that inflamed ligament underneath a much-needed vacation. You stop the trauma from every bite, and that dramatically cuts down on post-op pain. And this isn't just a hunch. The research backs this up big time. All right, let's get into one of the most misunderstood and honestly most misused tools in our toolbox, especially in emergency endo: antibiotics. So here's the scenario. A patient comes in with a contained, localized swelling. They are in a lot of pain, and they're probably asking you for an antibiotic. So what's the evidence-based answer? Is a pill going to help their pain? The answer for a localized infection that hasn't spread is a huge, emphatic no. An antibiotic will have zero, and I mean zero, effect on their pain. And here's the simple reason why. The antibiotic is floating around in the bloodstream, right? But the source of the whole problem, all that nasty bacteria-filled tissue, is locked inside the tooth, where there's no real blood supply. The antibiotic simply can't get in. The only way to get pain relief is to physically remove the source and release the pressure. It's mechanical, not pharmaceutical. So you're probably wondering, okay, so when do we use them? You only pull that trigger when the body is losing the fight locally. You're looking for red flags that the infection is spreading, things like diffuse swelling, a fever, or trismus, where they can barely open their mouth. In those cases, the antibiotic is there to help the body's immune system, not to treat the tooth itself. Now, if antibiotics are needed, this chart shows you what works. Amoxicillin is still your first-line workhorse. It's highly effective. And notice metronidazole by itself, not so great. That's because it only targets a specific type of bacteria. It's all about picking the right tool for the job. Okay, let's boil this all down. If you take away just one thing, let it be this core principle. This is it. Analgesics, painkillers, are for managing pain. Antibiotics are for managing a spreading infection. You get the patient out of pain with your dental treatment. You manage the infection with your dental treatment and, if needed, antibiotics. They are not the same thing. They are not interchangeable, period. So you did it. You handled the emergency. The patient's out of pain, they think you're a hero, high fives all around, right? Well, not so fast. Getting them out of pain is just the first battle. The real win, the long-term success, is making sure that tooth is properly restored and functioning for years to come. So how does what you did today set the stage for that victory down the road? That's the question that separates good from great.